So let's kick straight off and see what adaptations you should be making to your exercise routine once you find out that you're pregnant. Now, the Chief Medical Officer for the UK suggests that 2.5 hours a week of exercise at a moderate intensity is the optimum amount for women to look to achieve through their pregnancy. But the key thing is what is the optimum intensity? So we're going to break it down a little bit by trimester. But first of all, I think it's worth just whizzing through the benefits of training through your pregnancy. Now, many of you will already know this, but those benefits can include improved sleep, mood. It can reduce the risk of all kinds of things: preeclampsia, varicose veins, backache. It can reduce the risk of a C-section. And most importantly of all, it gets you fit for labour. You're going to want to hit that process knowing and feeling confident that you're able to cope with it. Now, many of you have emailed in some great questions about what you already do and how you should change it now that you know you're pregnant. So 20-something and trying, and Mummy D, really appreciate your questions, and they're really valid, and there's a lot of people that emailed in as well. Now, the key thing really when you're pregnant, especially in that first trimester, is to keep doing exactly what you were doing. Don't change anything drastically. What you can do is you can manage your expectations slightly, as you might not feel brilliant all of the time. You might get some nausea and sickness, but exercise will really help with that. And again, exercise is great for your mood, it's great for your sleep, it oxygenates your blood, and it will help with that nausea and morning sickness. So don't change what you were doing. If you're a runner, still run. If you're a cyclist, still cycle. If you're a swimmer, still swim. In short, do what you were doing, but manage your own expectations sensibly, because your energy levels might not be quite what they were. And one thing to absolutely watch is that you are always well hydrated and that you don't overheat, as your hormones can play a little bit of havoc with your internal thermostat. Now, as you move into your second trimester, this is your best chance of feeling great through your pregnancy. That's what's most widely reported by mums. So it's a great opportunity to maintain your fitness, or if you've struggled feeling not great through that first trimester, to reintroduce some of the things that you enjoy doing. Your energy levels should be great, your mood should be great, and you haven't yet got the big physical impediment of a huge bump. There are, however, a few things that you need to start to be aware of from about 16 weeks onwards. So the main one of those is that any exercises that involve you lying on your back should be limited, short bursts or not at all, as the weight of the baby inside you can put pressure on the blood vessels, and it might cause you to feel really lightheaded and dizzy, or even faint if you do it for too long. The other thing that you've got to be mindful is that you want to allow your tummy to grow, and you want the baby to have comfortable room. So you need to stop doing sit-ups. And I know that's a really hard thing for women to hear. They're always worried about their tummy, and we're going to cover a load of stuff about the core shortly in much more detail. But now's the time to stop doing sit-ups, stop focusing on those outer abs, and start to really think about your core muscles, your deep core muscles, your transverse abdominis, and your pelvic floor muscles. So it's a great thing to start introducing Kegels, and to really kind of research and understand a little bit more about your core and the best things you can do to train it. There's one other little rule and phrase that you'll hear bandied about quite a lot in prenatal exercise as well, and that's don't bump the bump. So anything that could potentially open the door to you having an impact-based injury, those are things that are definitely worth limiting as your precious baby grows inside you. Now, moving on to the third trimester, things can get tougher. So it's really important at this time that you start to listen to your own body. No matter how fit you've been and how desperate you are to keep exercising at an intensity, try and tune in to what your body's telling you to do, factor in enough rest and recuperation, and try as much as you can to enjoy the later stages of your pregnancy. Reduce the impact of your workouts and try and make sure there's not too many multi-directional movements or too many rotational movements taking place through your body, as they won't feel great. Again, keep working on your core exercises, particularly your pelvic floor and your Kegels. And at this stage, it's worth mentioning, as a few of you emailed in, that some people, about 1 in 6 mums, can experience something called pelvic girdle pain, PGP, or sometimes known as SPD, which is symphysis pubis disorder or dysfunction. And this is discomfort in the joints at the front and the back of your hips, and it can be physically painful, it can be emotionally really draining if you're always in pain, and it can be a very, very serious thing. It can be quite a mild thing. I wouldn't be comfortable doing my job if I stood here and told you what exercises to do for pelvic girdle pain, because it is an incredibly personal situation. So if you feel like you're experiencing those symptoms, this is one for your GP, and we're very fortunate that GP will refer you on to a physio who will properly assess and diagnose and then steer you on the right course of action, which could be exercise-based, could be hydrotherapy, could be rest. But the best thing to do there is to seek specialist advice and make sure that your own situation is properly diagnosed. This is definitely not the time for a one-size-fits-all, do these exercises type explanation. So listen to your body, and if you are concerned, seek the proper medical advice.